Everyone, welcome back to my vlog channel. So this video is going to be discussing the end of the COVID public health emergency, which is set to take place May 11th of this year. Now, as I said in my pre-sample video yesterday, I completely redid this video because I felt that the first video I did, I don't know, I think I could have done it better, and I preferred this time around to write my notes out rather than bookmark pages in my cell phone and read from my phone. So you're going to see in this video me glancing up this way because I have my notes taped to my mirror, which is behind my laptop here. And so don't get weirded out. You see me looking up, reading. It's just because I have them taped on the mirror, and I would rather do that and be able to look in the camera periodically versus have my head down and reading off my phone. All right, so first, let me say that there is going to be some immediate changes once this goes into effect, and there will be longer term changes. So let's cover what I want to call the immediate changes first. So people with private health insurance may have to pay for COVID tests, and that's both over-the-counter and labs, depending on their insurance plan. Seniors with Medicare Part B will start having to pay for over-the-counter tests, though the program will cover lab tests. Now keep in mind, we know the law of supply and demand, and odds are very good that the cost of over-the-counter tests will increase. When I was in Walmart back in the summer last year, I priced those tests that I had received for free through the mail, and they were going for, I think, almost $25, and that was 2 tests in a box. It was those blue ones. I think I actually showed them in a free sample haul from last summer. So just imagine, or pretty much assume, that the cost of over-the-counter tests will increase. That's probably a given. Now, this change, I really couldn't get much clarification on this, what exactly this meant. Hospitals will lose flexibility to expand capacity in response to surges. Now, I know that when COVID first got really bad, I was seeing a lot of news from New York that hospitals were taking to having people in wings that were, less used, and turning them into the COVID wings and everything. So I'm not understanding why, per se, a hospital wouldn't have the flexibility to do things like that if, God forbid, there was potential surges with, say, a very quick spreading variant. I really couldn't find any sort of clarification on that particular change. Yeah, so I'm not exactly sure what that would have to tie in with the end of the health emergency. I'm not really sure. The federal government can no longer require labs to report positive COVID test results to the CDC. Now, let's be honest. When states were required to start doing that, we could all vouch that it was a fiasco because it seemed numbers were off or they weren't being reported properly. And there was differences from state to state of how they were actually recording them and I guess reporting them. I remember just being in Pennsylvania groups and oh my God, people would be blasting the governor and the health secretary and just, oh my God, it was horrible. It was horrible. Some really rotten things were being said at the time that had absolutely nothing to do with COVID. But people forget, I mean, everyone was dealing, with something that they haven't dealt with before. So, I mean, yeah, it's not going to go smoothly until, you actually get the kinks worked out in the system and all. But yeah, that's one of the immediate effects of the end of the pandemic emergency. There's no longer going to be reporting to the CDC. Now we're going to get into the longer term changes. COVID vaccines and antivirals such as Paxlovid will remain free to everyone, regardless of insurance status, until the current federal stockpile runs out. Expanded telehealth through Medicare will also remain in place through December 2024. Under federal spending legislation passed in December, but it will end after that without congressional intervention, meaning that Congress has not approved or set aside money to continue funding telehealth. The FDA will still have authority to rapidly authorize COVID vaccines, tests, and treatments through its separate emergency power. Now we're going into my main reason for doing this video, something that I feel is super, super important, and that is this point. Millions of people are also at risk of losing their health insurance through Medicaid this year, as federal protections that kept people covered during the pandemic come to an end. These protections were tied to the public health emergency, but Congress then decided to phase them out separately. So think about that for a moment. Millions of people all around the country are at risk of losing their health insurance. And I'm especially thinking of homeless people. I'm thinking of people with long COVID who have had all kind of health problems after recovering from COVID. Yeah. In short, states can start kicking people off of Medicaid as early as April if they no longer meet the eligibility requirements for the public health program. HHS, which is Health and Human Services, plans to open a special enrollment period for these individuals so they can apply for coverage through the ACA, which, if you're not familiar what that stands for, that's the Affordable Care Act. But vaccines and treatments will remain free for everyone after the public health emergency ends. This may change for uninsured adults when the federal stockpile runs out. Well, that's a very comforting thought. That is something that will affect Ronnie unless he gets insurance through the ACA. I mean, he was fortunate he was able to get the shots and get a booster for free. But, yeah, once the federal stockpile runs out, he could find himself in a position where he might have to pay out of pocket for a booster. The The Biden administration plans to stop buying vaccines and treatments for the public as early as fall of this year, in part because Congress has not appropriated additional funding. When the federal government pulls out, vaccines and treatments will be purchased and distributed through the private market. Here we go with capitalism. And what that basically is going to mean is, obviously, the cost is going to increase because they're going to be purchased privately and distributed. The federal government will no longer be able to get a certain price for these items because they're buying them in bulk. And that's going to have an impact on healthcare professionals, hospitals, clinics. So this is going to be interesting, very interesting. People with insurance through the ACA and Medicare will still get the shots for free. Those on Medicaid will get the shots for free through September of 2024, after which point coverage will vary from state to state. Now, just because the public health emergency is ending May 11th, doesn't mean that we are never going to hear about COVID again. Nothing could actually be farther from the truth. And case in point, there was an article I seen online that really caught my eye. It was from February 3rd of this year. I originally seen it on MSN. And it says, the CDC is tracking another new potentially dangerous coronavirus variant called Orthrus, CH11. It got its name from a variant tracker in Australia. Orthrus in Greek mythology was a two-headed cattle dog. It looks very unique, and so does this new CH1.1 variant. While it comes from Omicron, the concern is that it has a mutation seen in Delta, and Delta was a deadly and potentially very dangerous strain. The variant has made its way not only to the United States, but to South Carolina in the past couple of weeks. Now, this article was from the beginning of February. As of about 3 weeks ago, which was before the beginning of February, in the United States, Orthrus was about 1.5% of the cases with the sequence of this variant. In South Carolina, at the same time, we were about 3.6%. However, our trends here in South Carolina, as far as hospitalizations and deaths, continue to trend downwards, even with this new variant. But I would imagine that the CDC is probably still keeping an eye on it. I just wanted to throw that in there because I just wanted to show, listen, COVID isn't gone, COVID isn't over. I think it's going to become a, unfortunately, maybe seasonal type of thing, like flu. And I don't think it's ever going to go away. Hopefully, at some point, it mutates down to something that is not so serious. You know, that's my hope with that. Pfizer and Moderna will sell the shots directly to healthcare providers, and whether you pay will depend on whether you are insured. Again, I just find that ironic. I had read several different articles about this, and one article said the cost for a shot could vary anywhere from $25 to possibly over $100, depending on where you might actually go to get the shot. That's a big difference. $25 could potentially be as high as $100. And nobody working gonna pay out of pocket $100 for a shot. I'm sorry, but no, they're just not gonna do that. So again, all these longer term changes are going to be really interesting, and I don't mean interesting in a good way. So, to sum everything up, adults who are uninsured will likely have to pay for shots out of pocket when the federal government stockpile runs out. And yeah, like I said, the prices are obviously going to increase with everything being sold privately, and time will tell with that. Overall, the widest ranging impact from the end of the public health emergency will likely be higher costs for COVID tests at home and those performed by clinicians. Like I said, yeah, that makes perfect sense. That's going to occur. We have a system based on capitalism. You'd be a fool not to think that the cost of anything related to COVID after this emergency declaration ends, that it wouldn't increase. I mean, we all know everything will. The downside to all of this is, as many Americans delay or go without needed care due to the cost, the end of free COVID tests could have broader implications for people's ability to get timely COVID diagnosis or prevent transmission of. Basically meaning if you have no insurance, you are kicked off of, say, Medicaid, and you get sick, say you're in a homeless camp, you can't get a free test now, and you don't have the money to pay for one. You know how quickly everybody around you is going to get sick. And then maybe you're going to a soup kitchen to eat, and maybe you're going to some sort of like a drop-off center or something. I mean, that can spread like boom, boom, boom. So, yeah, that's not a good thing. Also concerning is the fact that, the people who are found no longer eligible for Medicaid have to go through a certain time period to enroll and see what they can get through ACA. But just think of how tied up that website's going to get and crash. Not to mention if they're doing it by phone, hours of wait talking to people. What about documents they may need that maybe they don't have to be eligible for things? Like, this is going to be another fiasco. It really, truly is. And this is, I don't know, this is going to be a big, big problem down the road. I could already see this. Yeah, this is definitely something that I'm going to be keeping my eyes on when I see any news about it. Because yeah, this is just going to be a disaster, I think. A big disaster all the way around. And I'm not specifically talking about South Carolina. I'm talking about just all around the country. Yeah. I'll just have to keep my eyes peeled to, news I skim over at night and see, what happens with it as May 11th rolls. Honestly, the best thing for any one person to do is try to eat a reasonably healthy diet, get some exercise, try to boost your immune system as best you can, and try to, throughout all the craziness going on in the world, keep something of a positive mental outlook and attitude, and never lose your humor. Because if we all sat and took everything seriously, we would all be going crazy, or would have went crazy already. Alrighty guys, if you like this video, please give it a big thumbs up. If you haven't yet, please subscribe to this channel and hit that notification bell for all, so you're notified every time I upload a new video here on my vlog channel. Take care. Good night. I'll be seeing you all real soon on my next one. Bye.